guys, welcome back to my YouTube channel. If you're new here, please consider to subscribe, and if you are my returning subscriber, asante sana na karibuni sana. Apologies, last week hatukuwa na video, but we're back here, and today I want us to do something very different. I want to answer your frequently asked questions about HIV and AIDS, and just a quick reminder, this channel is all about breaking stigma surrounding HIV, and we are doing this because we want to create a community of understanding, a community of support, and most importantly, a community of empowerment. I hope mko poa, kuna baridi. Keep warm. Unaona venye nime keep warm? Please do that. So let's dive into the first question, and the first one is the difference between HIV and AIDS. Watu mpaka sahi hawajai jua difference ya HIV and AIDS. Utapata mtu akisema huyo alipata AIDS and all that. So guys, HIV is the virus. Tunasema ni human immunovirus. It's the virus that someone gets infected with, and AIDS is what develops once the virus multiply. If you multiply and someone is not taking drugs, that's when you developed to AIDS. And apparently we don't usually say AIDS sai, tunasema HD, advanced HIV disease, because AIDS was very, you're full blown back in the days, it was very stigmatizing, so isha rule you out. So we say mtu akona AHD, si ati akona AIDS. So when you're getting tested, you get tested for HIV, the virus. It's the virus. I am a young woman who is living with HIV. I'm not living with AIDS. I'm AHD with HIV. Remember, the reason we take drugs so that we take ARV so that they can reduce the multiplication of the HIV virus so that it does not multiply and develop into AIDS. I hope you understand. Nisisikie mtu akisema akinitext hapo akiniambia ati unajua yule alipata AIDS ama mimi niko na AIDS. No, you have HIV, you don't have AIDS, you don't have HD. So let's go to the next one. How can I tell if I have HIV or someone else has HIV? First and foremost, the first and the only thing that you can know about your status is by getting tested. That is the first thing. Getting tested. The only thing that you can confirm your status is by getting tested. Don't tell me you are feeling unasikia sijui nini, unasikia mgongo, no. All those signs and symptoms can be for something else. I've seen people saying that they have someone even having tuberculosis and they assume that they're positive. No, it's just that those signs can be for something else. The only way for you to confirm your HIV status is by getting tested. If you send me those symptoms and ask me about all that, nitakwambia tu ukweli, mimi sijui, kwa sababu inaweza kuwa hata hizo fever unapewa kwa sababu kuna kitu ingine. But the only thing for you to confirm about your status is by getting tested. And how do you know about someone else's status? You cannot know until you go with them and they get tested. Iyo kupimana na macho, mnaangalia mtu hivi unamwambia huyu ako nayo, huyu hana. That is what is making us have very many new infections in this country. Kwa sababu ukiona mtu anakaa poa, you just assume that they're okay, and they're not. Hawezi pimana na macho. The only way you can know about your HIV status is by getting tested. Remember, by testing I mean walk to a facility, get tested, and it doesn't matter the results. If the results are positive, you have another chance to get on treatment, start medication, adhere, and become used to you and continue with your life. If your results are negative, you have another chance to continue putting the preventive measures to maintain the same status. So the third one is, where can I get a HIV test and what's the benefit? Where do you get a HIV test? You can get squeezy, you can have a self-test kit. I have shown you previously about self-test kit. Kuna ile oro, kuna hii about ya check me. You can get that. You can get a test in any chemist. That kuna chemists zinakuanga ziko na kalab hapo nyuma. You can go and get a test. You can get a test in all public hospitals, private hospitals. We have dices, we have youth-friendly centers, we have community outreaches. These are centers. You can always get a test there. And remember, most of these facilities, testing is usually voluntary and it's free. But some facilities, those private facilities, utalipa maybe 100 ama 200, alafu you get tested. Remember, no one should coerce you to getting tested. It's a personal decision. And again, the benefits is that we've already mentioned previously that if your results are positive, you get on treatment, start on care, adhere, go to your clinics, do everything that is needed to be done, and you will continue their life. If it's negative, continue with the preventive measures that you've been putting to maintain the same status. And again, the benefit of testing is that knowing your status is taking responsibility of your life. I will never stop telling you the highest and most infections that we are getting today in this country, we are getting them because people do not want to get tested. We are getting them from people who do not know about their status. Sisi wenye tunajua hali yetu tunameza dawa na tunajua ukimeza dawa uko US2 huwezi infect. But nyinyi wenye hawajapimwa, you're the people who are spreading the virus. So we go to the fourth one, which body fluids transmit HIV. These are very critical one because I've seen people being very, I don't know whether it's being naive or being paranoid, but being paranoid most of the time. Someone meets me, I met someone, I think she's positive or he's positive, we kissed and all that. That drives us to the fluids that can transmit HIV. And they're just 5. Nimeishi kuambia ni 5. Hizo zingine zenye mna assumingi haziko, they're not there. So the first one is blood. The second one is breast milk. The third one is vaginal fluids. The fourth one is semen. And the fifth one is rectal fluids. Meskia, those are the only 5 fluids that can host or rather can transmit the HIV virus. Saliva, what will uliza juu ya saliva? The only way that if people ask if you can get HIV through kissing and all that, not unless you're kissing someone who has wounds and you equally have wounds. But contrary to that, you need 12 liters of saliva to transmit the virus. Sijui unaweza toa wapi. Ama kama uko nayo unaweza, sijui. So, let's be careful and let's know what is necessary. And I've seen even people in families, watu wanapea mtu mmoja sijui kikombe yake and all that. Those are things that do not happen today. And we'll discuss on the ways of transmission, maybe in the next one. It's actually the next one. How is HIV transmitted and how is it not transmitted? So, we have various ways of transmission. And we used to, when we were school, back in the days when we were in school, the syllabus was a little bit not very good. It was cruel. Because we used to know that HIV is just sexually transmitted. Hizo ndizo vitu zenye walikuwa wanatuambia hiyo wakati. But sai we have so many ways that one can get infected. We have one, sexual intercourse, that is one. It's the leading in transmission. Then we have mother-to-child transmission. And that is what we are trying to stop, either during birth or during breastfeeding. Because we said breast milk can host and can transmit the virus. Then we have the third one. When you share injectables, those injectables, sindano nini, those piercing objects and all that. We used to say about blood transfusion, but apparently the blood in us, it goes through a lot of screening right now that haiezi pita. Mimi usema hata mtu akiniambia niende nimpee damu siwezi mpea, itaenda tu kutupwa, haitasaidia anyone because there's a lot of screening that happens. And then we go to the sixth one, how do I protect myself from getting HIV? You have very many ways of prevention. We have them. The first one that we always advocate is abstinence. Most of the time we want to assume that abstinence is not, but that is the best and the most appropriate way of preventing HIV. From that, we have condom use, and I will repeat my slogan, and I always say that consistent and correct use of condoms will give you 99, if not 100% prevention against HIV, against STDs and STIs, and of course against unwanted pregnancies. We have the other one, we have prophylaxis, where we have PEP and we have PrEP. Those are prophylaxis that will help you. And of course, we have the last one. If you are dating maybe a partner who is positive, a discordant couple, if the person is adhering to the medication and then they'll achieve use to you. I hope tumeelewa hivyo. Tumesema we have PrEP and PEP. Those are the prophylaxis. PEP is post-exposure. PrEP is pre-exposure. We have condom use. We have abstinence. We have, and of course, sterilizing those things that are used in there. But that is not very frequent. It's bare kadogo hivyo. Then we go to the seventh one. Is there a cure for HIV? There is no cure for HIV. Guys, pastors, watu wenye ukuja kuniambia waniombe, kwanza I talk on my behalf. All those people, niko na dawa, mimi sitaki dawa. There is no cure for HIV. At this point, there is no cure. Maybe itakuja, but before then, what are you supposed to do? Before then, we are supposed to use what is available. I saw people being very, very paranoid about the injectable that is coming, and people are not aware. Your injection, see cure. What one assume ni cure? It's PrEP. It's PrEP, pre-exposure prophylaxis, that is preventing you from getting HIV. So it has no beneficial effects to us. Wewe ushapata, huwezi pata tena, huwezi itumia. It's for people who are negative, because all the prophylaxis are for people who are not positive, because they're supposed to prevent you from getting the virus. So let no one lie to you. Uende uko Loliodo, uende wapi, let no one lie to you. There's no cure. Maybe itakuja, lakini si leo, si kesho, na before itufikie, meza dawa tu pole pole. Do your things and let's live life. So the 8th one, what is the common opportunistic infection affecting people living with HIV? We have so many opportunistic infections that people who are positive because of the low immunity and all that go through. But now we have the common one when someone is not on treatment, someone is not adhering to treatment, and that is tuberculosis. Most instances, I always say that having tuberculosis doesn't mean that you have HIV. But if you're HIV positive, it's very easy. You're prone to getting tuberculosis. And most people have known about their status through getting TB. Then you go and get tested. Ukipata TB, unaenda unatestiwa most of the time. Not even always, they always do that. Because it's the leading opportunistic infections for anyone who is living with HIV. And probably they're not adhering, probably they don't know about their status. That is the first thing that will start to manifest, and then it will lead to someone getting tested. Remember, TB na tiba. Let's stop stigmatizing people in the community. Ukiona mtu amepata, anyone can get TB as long as you are interacting with people, not unless ukiamua utaishi peke yako in your own island and all that. But as long as you're interacting with people, you're living among people, you're prone to getting tuberculosis, and getting TB doesn't mean that someone is HIV positive. Let's stop that stigma. It's bad, really bad. Okay. The number 9, if one is sexually assaulted, what should they do? We have instances when maybe a child is assaulted, maybe a child is molested, not even a child, even an adult. You are raped, you are molested and all that. The first thing, and I always tell people, the first thing, please let it be known. Don't keep that to yourself. Because you don't know the status of the other person. You have no idea about anything. So what you are supposed to do, the first thing, take that person to the facility. Do not change anything. Hivyo venye kuosha, kufanya nini, don't do anything. Go to a facility, and if possible, go to a public facility, so that person is put on PEP before 72 hours elapse. Okay? Then after that, you can follow now the rest of the proceeding from the doctor, to the police and all that, and the reporting. But make sure that person, the specific individual, or rather the victim, goes to the hospital, either public or private. But I am an advocate for public hospitals. As much as we have so many deficits here and there, but they will give you some good proper treatment and the right way. You let them get tested. If they are positive, then they'll start on medication. And of course, that means that they've not gotten positive from that exposure. But if they are negative, they'll be put on PEP, and it should be before 72 hours. Tafadhalini. Don't come to me telling me you want PEP 5 days later. You're telling me you had an exposure 5 days ago. That is not, even though I give you, it won't help you. It's supposed to be administered 72 hours before. Okay? That is 3 days, before 3 days elapse. And remember, it's medication that you take for 28 days, and it prevents transmission of HIV. The last but not least, what is the difference between PEP and PrEP? I've done this so many times, but I still get people get confused. And PEP is post-exposure prophylaxis. And PrEP is pre-exposure prophylaxis. P, pre-exposure, before, post, after. So PEP is given before you get an exposure. If I'm dating someone who is negative and they're not comfortable with my UTU, or rather if I've not suppressed, they can be taken, as I take my ARVs, they'll be taking PrEP. Okay? If they're comfortable with my UTU status and all that, that is okay. But if they're not comfortable, please let them go to the clinic, let them get put on PrEP. Remember, we have event-driven PrEP. Event-driven is mostly used to the key population, and this is when you take a drug before the exposure. Yenye mmepanga, unataka kuonana na mtu, unajua je status zake ama hujui, then you take that. It's taken 2-1-1. Yes. So guys, I want you to please take note. Not take some good note. Not 2-1-1. I think ni 1-1-1. I am not sure about that. Please take good note that event-driven PrEP is not for everyone. It's for everyone who is at the key population and who is at risk. PrEP is for anyone who feels that they are not comfortable. They're not comfortable with whatever is happening. They're having multiple sexual partners and they don't know their status. Again, I want to remind you that PrEP does not prevent pregnancy. PrEP does not prevent STIs. It only prevents HIV. Sawa. Then we go to post-exposure prophylaxis. That is PEP. And I've previously mentioned that PEP is what you get after the exposure. Maybe a condom busted, maybe you were pricked, you shared some needles, maybe you had a pricking, maybe someone was molested or someone was raped and all that. That is when you get PEP. It's taken for 28 days. Sawa. It's 28 days. It must be administered before 72 hours elapse. Don't come after 72. Whether you take it, it will not haitakuwa effective. So anytime you have an exposure ama ukishukushuku, make sure that it's before 72 hours. Again, something I want to say that PEP and PrEP, they are not emergency pills. Okay, it's not emergency pill that kama venye tunasema pichu. If you had an exposure, you met something happened, unafikiri utameza kamoja ikuwe sawa. It's not an emergency pill. They are prophylaxis that help you and prevent you from getting HIV. So guys, those are my most frequently asked questions, and I took 10 of them, and maybe in the next video or some other time we'll do some few zingine 10 nitakuwa na wajibu hivyo, because they're the same questions that people keep asking every other time. And I want to remind you that we are doing this because this channel is all about breaking HIV stigma, and we always do this because we want to create a community of understanding, a community of support, and most importantly, a community of empowerment. Remember to subscribe. Remember to share this information. I want you who is watching this to be part of this conversation, because gone are the days that we used to discuss HIV under the carpet, and we need to tell people as it is. My name is Wanjiko Cleopatra, and I am a young woman living with HIV. Remember to subscribe. Na usikuwa una watch kama usubscribe, and I hope to see you in the next video. Bye.